So if you cut taxes, we're already in debt. If you cut taxes, you're going to have to make that money up somewhere. Where's it going to come from?
You got to cut spending. I mean, spending's out of control. And in fact, if you go to these tea parties, the biggest thing isn't cutting taxes. The biggest thing is the deficit's out of control, and we have to do something about it. We are spending money at $53,000 a second. The interest on the national debt is $30 billion a month. It's out of control, but that's also why you need an outsider who's not afraid to say no. I've promised people in this campaign I will not vote for any budget that's not balanced, Republican or Democrat. People say, oh, that's not feasible. That's not very practical. Well, no, it's not, but neither is $1.75 trillion deficits very practical. We've got to say no. But it's got to be on the spending side, too. You can't just cut taxes willy-nilly. And that's some of what Republicans have done and gotten a bad name for. Oh, Republicans, you just want to cut taxes for the rich, but you won't do anything about spending. Some of that's deserved. Republicans have cut taxes but haven't done anything about the spending. It's easier to cut taxes. You'd be happy for me to cut your taxes, but are you going to be as happy if I don't send you a federal project? And that's what it's going to take. And if I get elected, I'm not going to be earmarking stuff just for you or just for your community or just for my community in Western Kentucky. They asked me that the other day, it would be great to have somebody from Western Kentucky. You'll get federal money for Western Kentucky. I want the money to be distributed the way it's supposed to by civil servants at the state level. The federal money should come back, whether it's roads or education or whatever. It should be distributed according to a plan based on need by civil servants, but not by politicians saying, I'm from Bowling Green and I'm going to earmark it for Bowling Green. That's the provincial attitude that has gotten our deficit so exploded, and it's why I'm not afraid to come out here and say, I'm just not going to get you a special project. I want all of Kentucky to be better. I don't want one part of Kentucky to be better. I want lower taxes for everybody, and I want us to say, look, we can't continue just to spend pork barrel projects. We don't have the money.
Now, there are going to be those people that are going to say those pork barrel projects help create jobs. They help improve economic development for the region. So if you're saying you're not going to bring those types of projects to this region,
right,
Eastern Kentuckians sitting at home, why should they vote for you?
Because we're out of money. It's not that the emperor has no clothes, it's that the emperor has no money. There is no money. And so you have to realize there's a danger. I can promise that. People can get elected, they do all the time. Republican and Democrat, they promise you a project. There is no money in Washington. It's all gone. The only money left is theirs borrowed or printed. We're not taxing enough, so we're borrowing it from foreigners, and they're at wit's end with loaning to us. What's our biggest export right now? Debt. We sell our debt around the world. The biggest thing we sell around the world is debt. We got to do something about it. There are a million politicians who will come here to Eastern Kentucky and promise you something. I'm not one of them. I will promise you more freedom, less taxation, smaller government, and balanced budgets. But in the end, if I come and promise you a project and it leads to debt, debt leads to inflation, inflation leads to rising prices in your grocery store and at the pump. So it wouldn't be good of me to offer you more debt. We have too much debt now. And who gets hurt the worst? The working class and those on fixed income get hurt by rising prices. And that's what big government gets you. And you've got big government run amok.
Big debate going on in D.C. right now, obviously health care. Could you support any of the proposals that are on the table right now?
I think we need to reform health care, but we have to ask the first question, is the problem in health care too much government already or too little government? Too much capitalism, too little capitalism? My argument is there is no capitalism at all in health care. I'm a physician. I make profit. I'm private ownership. That sounds like capitalism, but there's no price mobility. There's no competition. I charge exactly the same as every other eye surgeon in the whole country for Medicare and Medicaid because the government sets the price. So the prices don't go up and down. That's not competition. Even for Blue Cross, Anthem, and Humana, no price competition, exact same price. If you've got Blue Cross and somebody else has Blue Cross and there are 4 doctors in town, we already charge the same price. So it's not working because the consumer's not buying the product. The consumer's buying insurance or prepaid health care, paying an enormous amount for it, and the only people getting rich off the system are the insurance companies.
Public option, a lot of talk about that. Would you support that?
No, I think the government needs to get out of medicine, not more involved with medicine. They tell us this bill, Baucus is supposed to be the moderate bill, Senator Baucus. It's going to cost $874 billion. But then they think you're asleep at the switch, so they say, oh, but it's really not going to cost anything or add anything to the debt because we're going to squeeze out $874 billion worth of waste and fraud. And I ask people, have you ever seen a government program that ever, didn't cost anything? So I think it's a pipe dream. It's going to cost an enormous amount. Every time the government tells you something will cost $800 billion, multiply by 2, and that's probably what it'll cost.
So how would you take care of the 45 million Americans or so that lack health care currently?
Right. I think you have to look at them and say, who are they? There's 45 million people. A third of them make more than $50,000 a year. So they're not buying insurance because it's expensive. So they're really not in the access part of the problem. They're in the expense part of the problem. That's a third of the 45 million. A third of them are eligible for Medicaid but don't sign up because they can just go waltz down to the ER anytime they want and get whatever they want. So they don't even bother because it's a waste of their time to sign up for Medicaid. 20% of them are illegal aliens. They've broken the law to come into our country, and we're driving this debate. They say they're not going to give it to them, but they've had 4 amendments already in Congress voted down that said you have to prove you're here legally to get the health insurance. The Democrats have voted every one of those down. So when they tell you illegal immigrants aren't going to get it, I don't think they're being completely honest. Are they lying? I think they're being disingenuous is a better way of putting it. But there's nothing to say that illegal immigrants couldn't get it because no one's going to ask them to tell us they're here legally.
Here's another question from Facebook. This comes from Steve down in Harlan. He says, government-issued health cards will artificially increase demand for health care while imposing restrictions and expense on health care providers, and insurance companies will certainly reduce supply of services that can be offered. As a doctor, does he have any ideas, or do you have any ideas for the resulting shortage?
Right. Absolutely. You know, P.J. O'Rourke, the humorist, says if you think healthcare is expensive now, wait till it's free. And he's right. That's what this caller is saying, and this person that's written in on the internet is saying that if you make it free or make it less expensive, it will be overutilized. And then what has to happen? They have to ration the care. Now, the people in Congress who want this, they hate the word rationing because they know Americans don't want rationing. They call it cost containment. But they already do this. In all the other systems, Canada and England, they ration your care. In England, they say precisely that in the last 6 months of life, you're worth $26,000. And if your medicine exceeds that $26,000, you're out of luck. We even have it in our country. You know, there was this big debate over whether death panels was overstating the cause. In our country, in Oregon, where we have assisted suicide, the state Medicaid plan sends out a letter, and I promise you this is true. It's been in the New York Times, so it has to be true. But there was a letter sent out by the state government that says, I'm sorry, Mrs. Smith, but you do not qualify for chemotherapy. However, as a consolation, you do qualify for assisted suicide. It's the government getting involved with these end-of-life decisions and deciding this. The government should never be between the family and the doctor. And I think a lot of Americans are like me. They don't like to be told what to do by Big Brother, and they're not going to be told what they can get from their doctor and what they can't.
Running short on time, but I want to try to get a couple more questions in here. This one also coming to us via the internet. Jerry Jane asked, what is your plan for seeing to it that senior citizens retain their present coverage for Medicare and Social Security? You touched on it a little bit.
Right. The problem with Medicare and Social Security is one of demographics. We used to have 7 workers for 1 retiree, and it worked real well, although we did borrow a lot of money from that system when we spent it in other places in the general budget, which I would oppose. I think Social Security and Medicare need to be in their own trust funds, same way with the Highway Trust Fund. We should not borrow that money and spend it in the general budget. That would go a long way towards shoring it up. The problem with Social Security and Medicare is you've now got 1 worker for every retiree, and we're chronically short of money already. And that's why it's ludicrous of them to add another $1 trillion and 46 million people into a government system. Medicare already is short of money and planned to go bankrupt within a few years. Social Security lasts a few years longer. We have to figure out what to do. In '84, they made a tough decision, and they changed the age from 65 to 67. Nobody wants to hear it, but the truth of the matter is eventually there'll have to be another panel, hopefully a bipartisan panel, so they don't blame just Republicans or blame one person, but the age is going to probably go to 70. Now, people attack me on that, but I think that's the demographics of it. We're short of money, people are living longer. With Medicare, I think one of the answers is we will have to maybe pay more directly when we go to the doctor with higher deductibles. But the trade-off is for the consumer, if you had a higher deductible, we get rid of price controls, and doctors' fees will have to be competing on a day-to-day basis, and hopefully competition can drive down prices.